Hi everyone, my name is Miss Sam and I'm back for another Therapy Tip Tuesday video. You can find me in the Wausau and Farmingville office. This week I want to talk about our early language development. I want to talk about some milestones. Then I'm going to show you some of the toys and strategies that I use during my sessions, and then some tips for home. So let's first get into our milestones. So first I want to talk about our receptive language. So what the child is understanding. So by 1 year, a child should be turning and looking in the direction of a sound. They can look at what you're pointing to, turning maybe when you call their name, and understanding common words like people or items. And then their expressive language by 1 year, they're usually babbling a long string of words together like up, 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 ba, ba, ba. They'll use sounds and gestures to keep your attention. And then at this point, between 12 and 18 months is where you should start seeing their first word. So a true word is described as a word when the child is able to associate that word with either a person or an object. So if their first word is mama, they're consistently using mama whenever mom is present. Or dada, they're consistently using when dad is present. Not just calling everything dada or everything mama, just for mom or dad. That's when you know it's their true word. So between 1 and 2, the child is able to point to a few body parts, maybe follow some one-step directions, and they're going to listen to some simple stories or songs. And then their expressive speech, they're starting to use a lot of new words. We'll start to see those early emerging sounds like P, B, M, H. They'll start to name pictures in a book, and they might even start to ask questions like, what's that? Who's that? Where's Kitty? And by 2, they're going to be starting to put together 2 words. So some things that I like to do during my therapy sessions to target our early language is use these picnic baskets. So these are awesome because they are all different colors, all colors of the rainbow, and they are all numbered. We also can open them and find little objects inside. So we can use berries. We also can work on putting an object in, following one-step directions, maybe close it up, and then asking for more. We also use a lot of baby sign with our little ones who are coming to start learning language. So I like to use more, give me, all done. And I also pair these signs with the verbalization. So working on our M sound for more or give me. Another object that I like to use, and I've talked about these before, is our dot markers. So we can work on our colors while coloring a picture, maybe trying for some word approximations like blue. And then I also like to hold the markers so that the patient is put in a situation where they need to ask for more or give me to practice those signs with the word approximation. Another object that I like to use during my sessions is these barns. Very similar to the picnic baskets, we can do open to work on some of our lip rounding. And then inside we can practice our animals. So we found a cow, and then we can work on the animal sounds that come along with it. And we can also put in, close it up to work on our one-step directions as well. So some tips for at home, and I tell a lot of my patients' parents this, is controlling a situation. Maybe even using sabotage. So if they're building up blocks, knocking the blocks over and going, uh-oh, and sabotaging the situation to try and elicit some language. Well, I'd like to wish everyone a better hearing and speech month, and I will see you next week for my last Therapy Tip Tuesday. Thank you.